Dear colleagues, hello. I'm Dr. Olga Schwab. Nice to see you today. Happy to see you again. In this video, I would like to talk with you about complications after dermal fillers injections. It's nowadays quite common situation because we walk a lot, and if you walk a lot, at least you have some complications. And a lot of people, they worry about it, they have a big stress. Oh my God, the complications happen, what shall I do? Really, it's a huge stress for some specialists and for our clients as well. And if the complication is happened, we feel very unhappy, uncertain, not convenient what to do face to face with complication. That's why I think the rule number one, this is to calm down and to help to have less stress for our patients as well. Because all these situations, believe me, they are manageable. It's very rare when we have complication which is very disaster and it's difficult to treat it. In my practice, I'm practicing more than 10 years. I never saw the complication what was not curable. And I will give you some examples today. I just want to tell that if you are ready to deal with the complication, if you are quiet, if you are relaxing, and if you know how to deal with the complication, how to treat it, you will be very successful and nothing bad will happen. So please consider the situation with complications as a normal working situation which could happen with everyone, unfortunately. And this is not about that you don't have experience or you've done a lot of mistakes or you've done something wrong. Sometimes it's a kind of mistake, but most of the times this is individual anatomy of the person. And we have a lot of anatomical variations, and sometimes we are just not lucky and we can go into the vessel and we could get the embolization. And of course I talk now about vascular complication because we worry about vascular complications more than about something else. And it's possible to get the complications with different fillers, with mild fillers, soft fillers, with strong fillers, with different brands, with different active ingredients, hyaluronic acid, calcium hydroxyapatite, and so on. But the treatment will be very similar. First of all, we need to inject the Hyalase. Hyalase, it's number one. First you calm down, and then the second you inject Hyalase. Injecting Hyalase will help you to restore the blood circulation, to increase the inflammation in the tissues very fast. Which Hyalase is better to inject? In my opinion, you can inject any Hyalase, but some of them are less allergic or more allergic. In my practice, I use most of the time PB serum. It's less allergic Hyalase in my opinion. It doesn't have tend to allergic reactions. And at any case, you can make this allergic test here in the skin on your arm. And if you have time, if it's not the biggest complication, and if you don't have a risk to lose the vision, you can do this allergic test and you can wait 10 minutes and you can see the reaction. If it's not the redness, I mean if it's not bigger than 1-2 centimeters, you can inject the Hyalase. If it's a little bit risky for the person, if your client gets some allergic reactions, especially to mosquito bites, for example, it could be a similar reaction to Hyalase then. So you need to inject at the same time, you need to inject hormones, not a big dosage, just to prevent the allergic reaction. And you can get also the anti-allergic tablets like antihistaminic tablet, what is available in your country. And after giving a higher LAS, you will see that the situation will become better and better. What about the dosage? How much higher LAS we need to inject in one time in one location? Everything depends on the case. If it's, for example, lower lip or upper lip, nasolabial fold, or chin, for example, you can inject in one time approximately 500 units of higher LAS. And if the complication is bigger, like 2 areas, for example, or 1 area but it's really big, you inject the whole amount. For example, if your higher LAS is 1,500 units, you can inject the whole vial. Sometimes you have 3,000 units. It's also possible to inject 3,000, just one dosage 1,500, then after 1-2 hours, the second part. So if you inject the necessary amount of higher LAS, you will see the good results very fast. And now I want to share with you one case. It was the complication, and the aesthetic specialist, she approached me and she sent me pictures, and we decided to inject the higher LAS. It was the vascular complication in the chin area. And in the first day after injection, she injected 1,500 units of PB serum higher LAS. And then it was become better. And then the next day it was again better. And it was no need for antibiotics, for some other treatment. It was solved very good, very fast. And the specialist was very brave, and her model as well. I would like to say thank you for them, that they share the case with us. It's very important to see these positive cases with the good, fast treatment. Sometimes I even don't use the higher LAS, because one of the best solutions in these cases, especially if the cases are not so big, this is leeches, the small animals, worms. This is small black or gray color medical leeches. And you can put them on the skin locally, and another you can put to their navel, and then they will restore their blood circulation, the lymphatic circulation, and they will decrease also the inflammation in the tissues. And they have more than 150 ferments. When they bite you and sucking the blood, they give into the blood more than 100 ingredients, more than 100 ferments, and including the higher LAS. And this is also a very good solution for specialists who are working, for example, in Germany, like chiropractors. And I know that you don't allowed to inject higher LAS, for example, and you don't allow to give the antibiotics. And if you have in your practice, if you have leeches, you can put them just in the water and put them in the bottle, and it's very easy then to take them out and to use it if it's necessary. So this is really the best solution. Sometimes you can combine. For example, you can inject higher LAS and then you can do leeches to improve the situation faster. If you have more questions about leeches, about how to inject higher LAS, and so on, please give me your opinion, your questions in comments, and I will be happy to share with you more information about it. Yes, and I can share with you some cases. For example, this girl, like small embolization, and the signs was inside the mouth after facial treatment as well. And on the next day, we done higher LAS to the area, and we done leeches to the navel. And the situation was solved during next 2 days. It was totally fine. And at the end of the day, sometimes people, they come back after procedure very late, and you already can see signs of necrosis. In this case, you have to do leeches as well, or you have to give the antibiotics like augmentin or amoxiclav or some other antibiotics. So you know what is allowed, what you have in your countries, and you also can add this to the treatment, and at the end of the day everything will be solved and we can deal even with the scar after the necrosis. We have a lot of kind of treatments like PRP and laser treatment and peelings and so on, and I'm sure that it's possible to deal with any complication and to solve it for ideal situation. And what else you can see among complications now? For example, it's already not vascular complication. Sometimes you can see some bumpings and sometimes fillers that were injected on the wrong place. Sometimes people somehow break the rules and they do some procedures off label. It makes sense, but sometimes not. For example, I don't understand why specialists they inject fillers like radius or luminera or crystallis into the lips or under the eyes area, and I see really quite a lot of complications with these bumpings and unwanted hypercorrections, you know, and it's really a big problem. If it was radius or luminera injected into the lips, you cannot get rid of these bumpings. You need the surgical operation to make it, and it's not a guarantee that it will be solved for 100%. So it's better to prevent these cases than to make the treatment. So be careful, and if the company recommends not to inject to certain areas of their product, it's better not to do that. So good luck. I'm wishing you not to have complications in your practice. If it will happen, you know how to deal with, and please let me know in comments your opinion, and I will be happy to see you in a new video. Bye bye.